Okay, started your 2 minutes time.
Okay, ma'am. Any other slide, ma'am? I'm ready, ma'am.
5 seconds.
Okay.
Start.
Hello, Lucy. I'm Dr. Rekha covering the labor ward today. How are you?
Ah, oh, yeah, doctor, I'm getting pain.
You're doing great.
Ah,
Well done.
ah, oof. Yeah, doctor.
Really, you are doing great. How are you coping with the pain?
No, doctor, I just wanted to have natural birth and born with my
Mm-hmm.
baby as early as possible. I'm not taking any pain relief.
Okay, I acknowledge your concerns. Midwife called me to see you as it's your first pregnancy, and you are really doing good. And you're pushing for the last 2 hours. Is that right?
Yeah, something like that she was saying. I do feel very much exhausted, doctor. I don't know why the baby is not coming.
Yeah, for that reason, I'm here. I will explain you in a moment. Before that, do you mind if I gather just few details from you and then we discuss a further management?
Oh, yeah.
Okay. Lucy, how's your labor has been so far?
Actually, it's all spontaneous. I'm I was doing quite great,
Mm-hmm.
but now I don't have courage to push the baby out, doctor. I'm totally tired.
Yes, I can see that you are tired. For that reason, I'm here to help you in your delivery. So, have you named your baby?
No.
Okay, and how's movement?
Yeah, moments are fine.
Okay. Any health issues which you're calling your
That
GP?
no,
Okay. Are you on medications using any?
no. Only iron
Okay,
supplementation. Only supplementation of pregnancy.
okay, that's fine. And any operation in the tummy and down below?
No.
Okay. And where's your partner? Somebody accompany you?
Yeah. Yeah, he had just gone out to bring something to drink me. He will
Okay,
be here
that's
at this
fine.
moment.
Okay. Thank you so much for giving me all these information. May I know your blood group
It's A positive.
and do you accept the blood if need arises?
Yeah.
Okay. So, anything else important you want to add?
I just wanted to deliver my baby as early as
Yes.
possible. I'm so
Uh,
totally tired.
Yes, coming to your concern, I can see that you did the great job. You get fully dilated and you are pushing for the last 2 hours. You are doing really doing good, but as already the 2 hours has been passed, and I can see that you are tired as well. So this is the time to assist your labor with the help of the instruments in the form of the forceps or the that are the spoon-like instruments or the cup. What are your thoughts?
Actually, doctor, I was very keen to deliver my baby naturally, normally, without having any intervention. Even I wanted to
Mm-hmm.
opt for home birth. I read
Mm-hmm.
so much about a normal birth, and I really
Mm-hmm.
wanted to embrace normal birth for my baby so that I can have a special bond with my baby.
Mm-hmm.
That's the reason even I didn't know the sex of my baby because I just wanted to keep it totally like a surprise package, and now all these things are.
Mm-hmm. Mm-hmm. I acknowledge your concerns and I must appreciate you that you want everything natural. But at this point, we are actually concerned that already the 2 hours has been passed and you are exhausted as well. With the further pushing, the baby can get distressed as the labor is a stressful situation. So, and also with the further pushing, the baby can deteriorate as well. I don't mean to scare you, and the womb can also get tired, stop contracting, so risk of the bleeding more after the delivery. So to avoid that, we are here to assist you.
Okay. Okay, doctor, then what are my options? Is it the only way? Can't I deliver normally by just giving a cut?
I'm sorry to say that already the cut will not help you to deliver as already the hormone drip is running, but it's not working.
Okay.
So we have the options. Either we can use the forcep or the you can use the vacuum. So do you have any concerns?
Oh my God, my friend had such a bad experience with this instrument. She had such a bad outcome with the baby, and her back passage was also had a very bad tear, doctor. I'm scared about that.
I'm really sorry that what has happened to your friend, but we don't know your friend's circumstances. That what has happened to your friend, it's not necessarily that happened to you. And you're right now your baby is doing very well, but with a but with the further pushing, the baby can deteriorate.
Okay. Okay, then
So
what next, doctor? So, what do you suggest? Whether the spoon or the cup? What do you suggest?
a cup can be an a suitable option for you. If you wish, I will discuss in details about the pros and the cons, and so that you can make the informed decision.
Yeah, go ahead.
Okay, so my midwife already examined you, but before applying the vacuum, I need to examine you. I will check your blood pressure, pulse, temperature, and also check your tongue and the skin to check for any signs of the dehydration. And your tummy examination from the down below to make sure that it is a better option for you. However, the midwife told me that the your baby is quite lower down, with but the baby is facing down. But however, the baby is slightly tilted towards the left side. Could be the reason behind the delayed progress in your case. Am I clear so far?
Okay.
So actually, a ventouse cup is a cup which will be applied on the specific area of the baby's head. With your push, when you have the contraction, you will push. At the same time, we will correct the tilt and we will gently deliver the baby.
Okay.
Am I clear? Okay. So it
Okay.
has the pros and the cons. We can avoid the risk of the anesthesia surgery with a successful vaginal delivery. You can be delivered soon, and you, as you are concerned about the bonding, so bonding will be great with your baby as well. And in the future, there's a great chance
Will
that
it
you
be
can
safe
deliver
for
without
my?
any.
Yeah, will it be safe for my baby also, doctor? I'm worried about that.
Yes, it is a safe option for your baby as well, but in the small chances that there is a chance that the baby head can have some mark on the head, but it will resolve in the 24 to 48 hour. And some bruise that causes cephalohematoma, but it does not require any treatment. Am I clear?
Okay.
And there is a risk on you, the chances of the tears on the back passage, but it is uncommon, 4 in 100 cases. Risk of the bleeding, but we will stitch the tear at the same time, and we will give the medications to reduce the risk of the bleeding as well. Any questions so far?
Okay. No,
Mm.
doctor. Don't you think C-section will be safer? Because I do have that fear of my friend's condition. So, what are your thoughts
Mhm.
about C-section?
Regarding your cesarean section, as the baby is quite low down, a cesarean section will be not a safe option for you. It can increase the risk of the tears, and also the next more extension of the tears, bleeding can be traumatic for the baby as well. So,
Okay.
are you
Yeah,
happy
doctor.
with the option with the ventoscope?
Oh, yeah. Okay. I may be going ahead. Yeah.
Okay. So we need to require your verbal consent. You can also discuss with your partner as well. Before that, we will ensure that the you are having the you are not using any pain relief. So anesthetic doctor will discuss with you the pain relief option in the form of the back needle if you wish, or otherwise we'll use a local anesthesia. What are your thoughts?
No, I will be okay with this local pain relief.
Okay, and also we'll give you antibiotic to reduce the risk of the infection. And you may need a small cut at the time of the delivery, but we will stitch at the same time. We'll also empty the bladder as well. Okay.
Okay. Yeah, doctor. Yeah, too much to. But it
Yes,
should
so
be
baby
safe
doc.
for me and my baby.
Yes, baby doctor will be there, and he also assess your baby as well to ensure that the baby is doing good.
Okay.
Okay. Any more questions you are having?
No.
So if in case it does not work, we will discuss with you the other options as well. Okay, and my consultant will be there to talk to you about
What
that.
will be
Okay,
my other options? What will be my other options?
what we will discuss with the consultant, and either you can we can apply another instrument, or either we can choose a cesarean section. But it's
But
very unlikely in your case.
rightly you said that cesarean section will not be a safer option, doctor.
If in case it does not work, it's unlikely as the baby is quite low down. It's unlikely. But if in case it does not work with the further three pulls, the baby does not come down, either we can use the spoons or the cesarean section. But it will be discussed with you before we go ahead.
Okay. And where are you going to apply this?
We will apply in the labor room. Okay, and also after the delivery, do you want me to discuss that what will be happen after the delivery?
Doctor, thank you.
Thank you so much.
Yeah. Okay. Good attempt. Um,
Thank you, ma'am.
what are your reflection about the task?
Ma'am, actually this is a skill of the
You
communication,
only.
so I
This is
tried, but
communication task. This
yes,
is
yes,
communication task. Okay.
yes, ma'am, yeah.
Yeah, you were good in communicating, but that last thing I don't understand why you said at plus three station, 3 centimeter below ischial spine, that means
Yes,
plus
ma'am.
three station. Why you said that last sentence and put your feet in the grave?
Ma'am, actually,
Mm.
I thought that if the three pulls, if the vacuum fails, then either we can use an instrument or the cesarean section.
See. Why cesarean section at plus three station? Your forcep will work wonderfully.
Yes, ma'am. Yeah, it was actually, I was thinking of the same, but yeah.
Yeah, so this kind of situation only will cause you your patient safety.
Okay. Yeah, okay, okay.
Okay,
I got
use
your
your
point, ma'am.
words
Yes.
wisely. Use your word wisely. I do have some more concerns. We will discuss that. But overall, the task was very good. and you have done it also very nice. So you explained me the need for an instrumental, what I was you were supposed to do within the next 10 minutes. Explain the need for an instrumental delivery, then ascertain my views also, because I wanted to have my views were, I wanted to have a normal natural birth, and that's the reason I tried everything, even I am
Hmm.
not taking any pain relief also. Okay, and
Yes, ma'am.
explore her concerns and provide guidance for a safe outcome. Okay, so that is all. You had given me a quite means the answer key, you had completed that 10 minutes task what you were expected. Okay, the
Yes,
history
ma'am.
taking was well within time, everything was well within time, but involvement of consultant, that one extra minute could have been saved. Okay, you
Okay,
should have
ma'am. Yeah.
involved consultant initially, you should have given me information leaflet, or you can at least say that once you
Hmm.
will be safe, we
My
will
time
debrief
finished,
you.
ma'am.
No, so no,
Yeah.
that sentence, we will be debrief you
Yes.
and we provide you with patient information leaflet. Why verbal
Okay.
consent? Say consent only, na dear. Whether it is verbal, instrumental,
Oh,
whatever
yeah.
it is,
Okay.
say consent. Why you want to say verbal consent? Okay.
Yeah. Okay. Yes. Yeah.
Okay.
Got your
Now,
point.
in the history, what you missed out was antenatal history. Okay, antenatal care history. You didn't ask me how was my pregnancy. I would have said it
Mm-hmm.
was low risk pregnancy. Nothing was there. Okay, that
Mm-hmm.
history you missed. BMI, I feel it is important, because if it is a high BMI, then your chances of, you can assess the failure risk and all those things. Okay, so BMI is one important point in laboring patient. Since the patient is under midwifery unit, you can
Mm-hmm.
assume that she is having a normal BMI. Okay, you
Okay,
can
ma'am.
assume.
Yeah.
Okay, rest of the history which you assumed and it has not been given anywhere. She is primey. Where it has been mentioned that she is primey,
Ma'am,
assumption
at
is.
first, first, ma'am, first.
First, I have shared.
Mm. Yeah, it's not mentioned here. Yes. Yeah. Mm-hmm.
Okay.
Yes, ma'am. Yeah.
Then
Yeah. Yeah.
where it has been mentioned that she is fully dilated from 2 hours.
Ma'am, this is mentioned that she is fully for the 2 hours in the first candidate instruction in the first slide.
Where?
Over 2 hours, fully dilated over 2 hours. First,
Okay,
second line,
it
ma'am.
is okay, okay, okay. Yeah, so that is okay. That way I will take it. Okay. So I was,
Mm.
because that number I was searching and I couldn't get the number. So that is
Okay,
okay.
ma'am. Yeah.
Okay.
Okay.
Another thing, gestational age, dear. You were applying a instrument that is kiwi cup.
Yeah. Okay, ma'am. Yes. Yeah.
What is about gestational age? What if
Mm.
I'm
Yes.
preterm? Although I will not be preterm when I will be in a midwifery care unit, I will not be a preterm. But these are the glitches they are giving you.
Mm. Okay,
Okay,
ma'am.
so whether
Yes.
it is primary, whether it is gestational age, where it is safe to uh, apply the force instrument, kiwi instrument. Okay, so those points do not miss out. So that gestational age, you missed it
Remember,
out.
in the initial point, I just mentioned it's a first pregnancy. So I mentioned it's a first pregnancy. Is that right? So you mentioned yes. So we cannot say like this.
I think you mentioned, you assumed actually. That's the reason I had mentioned here assumption, first pregnancy.
Okay.
You
Yeah.
you
Okay.
assumed
Yes,
and
ma'am.
you continued the same sentences. You didn't ask me whether it is my first pregnancy. If you would have asked, I would not have
Mm.
written that assumption, because you assume since you
Mm-hmm.
are this is your first pregnancy and you are 2 hour, so that was your sentence,
Mm.
something like that. Okay,
Okay. Yeah. Yeah. Yeah.
and then gestational age you didn't ask and you applied me for a vacuum. Okay,
Mm-hmm.
then rest of the thing, okay. Why marks? There will not be any marks of kiwi forceps. Okay, kiwi cup. There will be only chignon, not even
My Shignon,
cephalematoma.
I want to say the mark of Shignon
Cephal
basically.
hematoma, yeah, cephal hematoma is something which is very serious. Rather than that, you can just say that, yeah, due to the suction or due to the pressure, the fluid will be accumulated in under the baby's skin, and that will
Mm.
go off on its own. That one simple
Yeah.
sentences would have been the best thing.
Okay. Okay,
No,
ma'am.
no other concerns with the baby. because
Okay.
you know that this is a very low lying baby, means the baby
Hmm.
station is very low. There are very good chances that she will deliver with a single instrument. So these are only my points and these are only my concerns what I had mentioned here. Okay,
Thank
then
you, ma'am. Yeah,
where
thank
is
you,
the
ma'am.
patient? Where is your patient? Patient is in, they had not mentioned, but the patient
It's
is in
not, ma'am, it's
midwifery.
not mentioned here. It's not mentioned here.
Yeah. Okay, so we will
If in the
just take
midwifery
it.
unit, we will
Yeah.
shift to the
Yeah,
consultant-led units.
consultant
Yes.
unit. Always remember
Got your
that.
point, ma'am.
Yeah,
Yes.
always remember that because these are the glitches, these are the small, small
Hmm.
situational awareness which you will
Yeah,
miss
yeah.
out. Okay. Apart from
Yes.
that, I don't have anything. Let's go through my answer key. Almost similar.
Thank you so
One
much,
or
doctor.
yeah, one or two points which are different here, what I had mentioned here. Okay. Ask her about labor and acknowledge labor pain. Okay. I can see you are doing great. You have come a long way. Very nicely. You had appreciated. You acknowledged. My concern was wanted to have more natural, normal birth. And for that, I read lots of book. Again, you can appreciate very good and you are doing really good, great. Up till now they were very, means you have progressed very good. Parity, gestational age, previous labor record if it is multipara. Okay, MOD especially. Antenatal history, can you just tell me about your pregnancy? Doctor, it was a normal pregnancy, low risk pregnancy, there wasn't anything to worry about. Okay, you can just say that okay, I would like to access the case notes. Then partogram also you can take a input from partogram. Okay, that is one information gathering point. Blood group, JOA, allergy, any surgery, and then BMI. Medical history also you can ask or you can skip, but okay, if it is a medical disorder which will be there significantly, then again you that vacuum may not be applicable. So means I will add on that point in my answer key. See, here they had not mentioned. Now there are the scenario in the RCOG exam where they have given you the duration of full dilatation. If they had given you duration of full dilatation, when you are going to suspect delay in second stage and when you are going to diagnose delay in second stage, 3 hours in primary and 2 hours in multi is diagnosed delay in second stage. Okay, two
Yes,
hours
ma'am.
in primary
Yes.
and 1 hour or 30 minutes. I think 1 hour or 30 minutes. I'm not very sure. Will be diagnosed delay in second stage. So here they had not mentioned anything. So in this task you are not going to comment whether it is a delayed present second delay in second stage. Here it is only maternal exhaustion will be the only concern here. Okay, so please remember
Okay.
in this task I'm using it as a key answer key. But if the duration has been given, then you have to explain that it is not safe to convey it beyond this time. Okay, it is not safe to wait beyond this time. But here you I can see that you are looking very much exhausted, so let me offer you some fluid through the drip, so reposition you, and if you are okay I can offer you some pain relief. What are your thoughts? Because she doesn't want that. This will feel you better, but yes, you are taking long and the baby is just about to come, but it is taking long and you are not having energy to push the baby, and that's the reason I would like to offer you some help. What are your thoughts? Okay, why I am offering it is not because of the delay in second stage. I'm offering because I'm worried about your exhaustion. I can see you are tired, you are not able to push, you will require some energy. Until that time I will definitely make you comfortable by giving you some fluids, giving you some, offering you some pain relief, might be repositioning you. And the baby's FHR are normal, that also you have to explain, dear. Okay, that one point also you missed out.
Ma'am,
Ask
later
her.
on I mentioned that your baby is doing fine. But ma'am,
Okay,
she's already fully dilated 2 hours without the epidural. It is also an indication, ma'am.
whether 2 hours, it has been mentioned without epidural. Yeah, you here you can mention, here you can mention. No, but now this new guideline has not mentioned with epidural or no, without epidural. It was
Ma'am,
there
they have
initially.
mentioned with epidural, they have mentioned with the exhaustion, they have mentioned pushing, they have mentioned.
Okay, just put that screenshot. Then we can
Yes, I will
explain.
put.
Yeah, then in
Yes.
that case, in this case also we can say that it's a delayed labor. So it is delayed second stage of labor, what we have seen, and the baby is not coming out, and it is you are actually exhausted. So there, these are multiple factors. And waiting beyond this time, we have seen a very adverse outcome in the baby. What you are going to say? Waiting beyond this period and your exhaustion will cause a adverse outcome in the baby, like baby may take time to cry, baby may require some assisted ventilation, may get admitted into the NICU, and sometimes there will be lack of oxygen for a prolonged time and some injury, brain injuries. Okay, so we do not want this, we do not want this as of now, and that's the reason I'm here to offer you help. Okay, now explain her PV finding. You do not need to examine her dear here. Okay, you just need to, you do not need to take her pulse, blood pressure, PA, PV. You just explain her PV
Okay.
findings. Yeah, so now I can see
Okay.
you have complete, yeah, you have dilated. So that is the interpretation what you are communicating to the patient. I can see that the baby is in the left occipital anterior position, that means on the left hand side, which is normal,